thank you for watching Derek Jones Facial Plastic Surgery. I'm your host, Andrea Housand. I'm also the practice coordinator for Dr. Derek Jones, and we are here tonight with a special guest, Savannah Smith. She is here to talk about her rhinoplasty experience with us, and we're so happy she's on the show with us. Hey, Savannah.
Hi, how are you?
Doing great. We're just happy you're here. It's rare we get patients to come on with us, so when they do, we're excited because they can share their experiences.
Yes, ma'am. I'm happy to be here.
And tell us how, we know how you found us, but let them know like how you heard about Dr. Jones.
Yes, so I went to a specialist in our area to talk about my breathing issues, and he immediately recommended Dr. Jones.
Yeah, and you had surgery before.
Yes, ma'am.
Tell us a little bit about that.
Yes, so I had surgery back in 2020, and I kept playing a contact sport even after my surgery, and ultimately that resulted in even more damage to my nose, which is when I decided to go to a specialist who recommended Dr. Jones.
Yeah, that's wonderful. And I know that also you know Mary Chastain as well, and
Yes,
she
ma'am.
said some great things about us, and we're always thankful for those referrals. What kind of contact sport was it?
I played soccer.
Oh, that's aggressive.
Yes,
Very
ma'am.
aggressive. You're not doing that anymore, though, are
No,
you?
ma'am. Ever since
Not
surgery,
after
we
this.
do? Absolutely not.
Yeah.
That is true. We do have that discussion typically with patients if they play a sport like soccer and they're going to have a rhinoplasty, especially about their playing career and things like that. And I've had patients that played in college and say you may want to wait until after to have something like that done because you're at a little bit more risk of injury after surgery than before even. So, but yeah, you may want to protect your nose a little bit. So.
Yes, sir.
Well, let's talk a little bit about too, like kind of what we've got coming up, where we're going to be and everything. Speaking of Mary Chastain, we're going to be over there, and we're going to talk a little bit about that first. Then we're going to show some pictures in just a moment. So let's go through some of this housekeeping stuff first. So save the dates of where we're going to be coming up. We're always in Gulf Breeze on Fridays on 207 Gulf Breeze Parkway. We've been out there now for 4 years. We've had our office out there, and it's with the Hearing Center, and you'll see my logo and our ear, nose, and throat. So come see us in Gulf Breeze. Again, 207 Gulf Breeze Parkway, right between the Baskin Robbins and the Poke Bowl. This is exactly where we are out there. So, but come see us. You'll see my logo on the door and all the names of all our providers. This is our waiting room there. So on Fridays we're in Gulf Breeze, so come see us there and give us a call. Give Andrea a call, 484-FACE, 484-3223 is the number to call. We got a couple of other places we've got coming up this summer. We're going to be at Fringe out in Pace on August 28th from 9 to noon basically. So if you want to get injectable appointments out there, you can call them at 994-2104 or again 484-FACE, 484-3223. So we're going to be at Fringe in August. September, we're going to be at Chastain's with Mary Chastain and Deborah Ward and all the good folks there. And again, injectable appointments and fillers. So come see us in East Hill in September. And then as we get into the fall in October, we're going to be downtown at Result. And we will be there on October 23rd, again from 9 to noon. So you can give them a call. You can give Lisa a call at 466-5309. Or again, you can always get in touch with us by calling 484-FACE, 484-3223, and get in touch with Andrea and schedule at any one of those places or our Gulf Breeze office or our main office at the Medical Center Clinic on Davis Highway. So those are the places we're going to be. You can also follow us on Facebook, and that way you can kind of keep up with where we're going to be and what we're going to do. So
I try not to inundate the Facebook feed or the email blast, but if you really want to know where we're at, let me know. Right now we are on a wait list for a lot of our offsite locations. So yeah, just give me a call at 484-FACE. That's 484-3223. Easy one to remember. But back to you, Savannah.
Yeah.
Had you always wanted to have rhinoplasty, or is it something that happened after your nasal injuries?
So after my nasal injuries, I really sort of developed more of an insecurity about my nose. And even in middle school and in high school, I would kind of get made fun of for having more of a collapsed appearance on my nose. And eventually that led to me just begging my mom for a nose job.
Oh, I totally can relate to that. Just growing up Greek, I have that going for me. I always disliked my nose as well. And then when puberty hit, everything gets bigger, my nose included. So I totally get that. And that's usually about the time, Dr. Jones, when the nose changes, right?
Yeah, it's early teens is when the nose starts to grow, and we've had so many patients tell us that that's when they really wanted to have the nose job, is when they were 13, 14, 15, and the nose starts growing, and you go from that really sort of cute little infantile nose that most kids have, and then as you get into adolescence, the nose grows, it gets bigger depending on what nose you're going to end up with as an adult, but the nose can get bigger, and that's when girls especially start to notice that their nose is it's different, it's a little bit bigger, and that's when they get interested in having a nose job. But obviously you had the trauma, which is a little bit different issue, and with the trauma, I'm sure that made your nose look a little bit different and also not work quite as well either.
Yes, sir, exactly.
Yeah.
Playing defense, I have to protect the goal, and that involved doing it with my face. So unfortunately,
wow.
yeah.
Did you have a mask on too, or no?
No,
There's
no
mask. Oh,
because I didn't want
that's
anyone to
awkward.
know that my nose was injured, so no girls would actually hit it on purpose.
Right,
okay.
yeah. Don't show any weakness from
Absolutely.
that. Yeah.
That's right.
Well, let's show your pictures so that people can see kind of where we were and where we are now, and we can comment a little bit on that. But on the front view, as is often the case, you can't tell that much difference, but you'll be able to see as we go to our side view and everything. But you did have, and we'll show the base view where you can see the collapse that you had before. When you would breathe in, your nose would literally collapse, which can happen. It can happen with trauma, or some people's noses are like that. But as you can start to see here, we did make your nose a little bit smaller and a little more rotated, the tip a little bit more rotated, and also, which you can really see on the profile there. And this is 1 year, right? It's been 1 year since the surgery. What we find is really the nose continues to get a little bit more defined even after a year, but it can take quite a while before you really start to see the definition, or a little bit more definition. The tip and the swelling goes down more. I think you've liked it from the very beginning, I think, but have you noticed much change over the past year, or?
Oh, absolutely.
Yeah.
Especially as the summer months go away and we go more into fall, I don't feel as much swelling by any means.
Right. So there's profile, and again, this is the other side, and I really think it just takes the emphasis off the nose, so people really don't notice your nose as much, and puts it more on the eyes and the smile, which really are the focal parts of the face. And so people don't notice your nose as much, but really just a softer appearing. And I know we talked about it before, and this is sort of the type of nose that you were the most interested in anyway. So I don't tell people we can give you a specific nose, but try to make some subtle differences in potentially the way things are done, so that it looks maybe a little bit more scooped out, not significantly, but a little bit more like that. And but again, like I said, I think it really fits your face, and it's just made a really nice difference. So. And the functional part is very important. This is the base view that we always take before, and you can really see the collapse, especially on the right side, on her right side, before, when she would breathe in through her nose, it just collapsed that side of the nose. So,
oh, wow.
Yeah.
You probably, I don't know if you realized that it was
No.
collapsing like that, did you?
No, I knew it was bad. I heard the doctor say, oh, wow. And it really is, oh, wow.
Yeah, it was pretty bad. This is the base view now, which again, is, really, it looks almost a little bit more narrow in the after pictures, but it has so much more support that it doesn't collapse like that anymore. I mean, it's just, it's got much better support of the lower 2/3 of the nose, which is the cartilage part of the nose, and all. And so, and then just the,
Look how happy you are.
yeah, exactly. The look on your face says it all, I think. So,
Absolutely.
Yeah, it looks really good. I like that, a lot of patients come in and they do want a particular nose, but Dr. Jones has to, manage those expectations. You just can't say, I want this nose, I want this nose. It's got to fit your face. And I think what you asked for looks amazing, and it was something he was able to do. So it looks really good.
Absolutely, and that's one of the reasons I loved working with you the most, is because you actually listened to me and you were able to accommodate exactly what I wanted for appearance-wise, as well as functionality. I wasn't able to truly breathe correctly, as you can see from the photos of the collapsed side, and now I can actually breathe, and I like looking at it too.
Yeah, that's the thing. And like we said, we can't give someone a particular nose, but when someone says, I'd really like it to be, a little bit more, a little bit more of a super tip depression or that kind of thing, make the tip look a little bit, there are certain things we can do and sort of err on that side, but really it's making your nose look the best. I mean, and that's what we could do with surgery, is take the nose you have and make it look the best it can look, and work the best it can work too, because that's what's so important. I mean, you want to be able to breathe through your nose.
Absolutely.
So we are taking a break. Stay tuned. We'll be back. Many who consider facial plastic surgery are concerned their results will look unnatural. But with over 20 years of serving the Pensacola community, his thousands of satisfied patients have made Dr. Derek Jones a trusted reconstructive and facial plastic surgeon known for industry-leading results that look natural. Call 850-484-FACE to schedule a consultation at one of our locations in Pensacola and Gulf Breeze.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
Imagine a new kind of hearing experience that lets you hear more of everything. ReSound Lynx, the world's smartest hearing aid.
I'm Dr. Mark Lees with Mark Lees Skincare Incorporated.
I've been in the business for 4 decades. I've seen tons of Dr. Jones' work. Dr. Jones actually worked on a really good friend of mine, took 15 years off his face. It was just amazing. So it was really, today is the day. I got to call Dr. Jones. My only regret in having my work done was the fact that I didn't have it done about 3 years earlier.
I'm Dr. Derek Jones. Trust your face to a facial plastic surgeon.
Welcome back to Derek Jones Facial Plastic Surgery. In case you missed it, we're talking about rhinoplasty, and we have a special guest with us tonight to talk about her experience. Her name's Savannah Smith. Thanks again for coming with us.
Thank you for having me.
Yeah, before we went to the commercial break, we were showing her before and afters, and just beautiful before and afters. But Dr. Jones also did my nose. It's been about six years.
6.5. Will it be 7 in December? Is that what it'll be?
Gosh.
I think that's, yeah.
Time flies when you have a beautiful nose. Thank you, Dr. Jones.
Absolutely.
Best thing that's ever happened to both of us.
I agree.
Speaking of beautiful noses, it's not something, you walk up to someone and say, hey, you have a beautiful nose. And it's in the consultation process, you'll talk about that. No one ever comes up to you and says that. They say, you have a beautiful smile, or you have beautiful eyes. And one night I was at a bar, so the guy probably had a few drinks. That's okay. But he did say to me, he said, excuse me, but I have something very odd to say to you. I think you have the most beautiful nose I've ever seen. And I said, excuse me, say that again? So I couldn't wait to go to work and tell Dr. Jones that story. And Savannah has a similar story.
Yes, actually, that story reminds me just of my experience when I was in college. I had a sorority sister come up to me and say, "Oh my gosh, I just love your nose. You have the most perfect nose." And it really just made me grateful for everything Dr. Jones did for me, and it is my
awesome.
favorite. And I told her where she could get one too.
That's right.
Yeah. So
Yeah,
that's-
it
yeah.
is funny because I always do say, really the eyes and the smile are the focal parts of the face, and most of the time people don't notice your nose unless it's for not a good reason, like if it's too big or if it's crooked or something like that. Otherwise, people, don't usually notice noses that much unless they have an interest. Like, I mean, I notice a lot of noses, but I do noses. People who are looking at noses because they don't like their own nose tell me they like look at a lot of noses as well. But a lot of times if you just meet somebody, you look at their eyes or they have a nice smile or that kind of thing, you don't notice their nose that much. And one of the things I try to do from a surgical standpoint is just to make the nose kind of disappear into the face so that it's not noticeable. It doesn't distract from the eyes, the smile. It's just, it looks normal. And one of the things I say too is that if you make something look normal, even though there's a big change, a lot of times people don't notice as much. They can't really put their finger on what the big difference is. I don't know if that's your experience or
Absolutely.
not, but yeah, because people just say like, you look better, but I don't really know why.
Yes,
And-
sir. Actually, had someone ask me if I had my lips done. They had no idea what
really?
it was. They knew something was off with my face, but they couldn't tell which one it was.
Yeah, and that's if you make it look normal, like it's supposed to look. That's typically what people will say. They can't put their finger. They're not really sure, but they know you look better because it looks better, but it looks normal, and so it doesn't stick out to them. And I think that's where we are with your nose. Obviously, it looks great, and it super fits your face. And let's go. Let's show the pictures again. The picture really tells the tale when we're looking at cosmetic surgery like this. So, as you can see on the front view, there's not a really obvious difference, although there's some subtle differences. I think the tip of the nose has a little bit more definition than it did before, but there's, again, it's harder to see on the front view what we're really talking about in terms of the changes that we made. As we go to the 3/4 view, you can really start to see that the tip of the nose is rotated. So we talk about rotation of the tip being if you rotate the nose, it goes up some. If you derotate the nose, it goes down. So you can see that we rotated the tip up a little bit, and also decrease the bridge, or what we call the dorsum of the nose, and gave a little bit, decreased it a little bit more than the tip, and so it gave a really nice shape that fits your face. And again, I think really looks very normal and natural and doesn't distract people from your eyes or your smile. And again, this profile view, again, similar in terms of just showing the profile of the nose and how that looks so much different. And I always say, it looks a lot different, but really, it's just a few millimeters here and there, and that's one of the challenges of working on the nose. You can tell small differences. When we were talking about the function of the nose and breathing through your nose, the base view of the nose shows the collapse that was there before, and again, I think it was a result of trauma and just having weakened the cartilage, and also causing the stuffiness. And I know you'd had surgery, but there still was some septal issues, things like that needed to be dealt with at the time as well. And you can see the base view. The tip looks a little bit better defined, and the nostrils, although they don't look bigger per se, they just have better structure and support, and they're not collapsing like they were before. And so, yeah, it just fits your face, and it looks great.
It does. I mean, you were beautiful before, you're beautiful after. So it's easier to make a pretty face prettier, right, Dr. Jones?
Absolutely. It's always easier to make a pretty face prettier.
Well, not easy, but I mean, the nose is the most challenging
For sure.
surgery.
No, but it definitely makes a difference, and the nose is most challenging. The reasons the nose is most challenging because it's right in the middle of the face, so there's no real place to hide anything. Again, small differences are noticeable, and it's interrelated. So you make one change in the bridge of the nose, and it can affect the tip, and vice versa. And so it's all interrelated. All the pieces that we change are interrelated, and so you have to make sure you manage all those changes at the same time so that it comes out to a balanced nose. It's also going to fit the face, and so it is the most challenging surgery that we do is rhinoplasty surgery, and it takes time to really get good at it. I mean, to do the numbers of cases you have to do to get good at it. So
Speaking of, today is Dr. Jones's 25th work anniversary.
That's right.
Today's the day. 25
That's right.
years.
25 years. It's hard to believe. So it's great to have that kind of experience. I mean, it's really been a blessing. It's a lot of fun. It's challenging, but when you have great patients and I'm able to look at some beautiful faces and beautiful noses like they're sitting next to me, it's very rewarding. So it's really been a great experience. And it's not like we're not quitting yet. I mean, we got several more years to go before. So we got a long ways to go. But it is nice to be experienced and to have been able to do this over the years. It really has been a blessing. So.
Yeah. So what was the most challenging part of this surgery for you?
Oh, that's a good question. But I would say the most challenging part for me for the surgery was having to wait to take the cast off initially. I was just so excited to see all the work you've done. But on a more serious note, I would say a really challenging part was realizing how much you actually do touch your nose. You don't realize how much you touch it.
Yeah.
You have no idea until you can't touch it anymore, and you have to be careful, putting clothes on and off.
Yeah, and you have some tenderness afterwards. You really kind of want to stay away from it, for a while, for sure. Yeah, that is true. I guess the recovery in general wasn't too bad. I mean, I usually tell people like the stuffiness bothers people more than the pain. It's not terribly painful surgery, but I mean, what would you say about that?
It's definitely not painful. It's just more uncomfortable. It's just not painful. It's just a very uncomfortable thing because you have something on your face, and initially you have 2 things of gauze inside your nose for 2 weeks before.
Yeah, it's really just we put some packing in overnight. We take out the next day, but then it is stuffy that first week, and we do some cleaning after a week, and that's usually when you can breathe better and everything. So, but yeah, it is. I guess in your case, I mean, someone who's had nasal trauma before, you probably had that experience of having some nose pain, so it probably wasn't that unfamiliar or too bad for you. So
definitely. I remember actually waking up and thinking that the surgery was completely done. There was no more packing in my nose because I could just breathe so much better, but there actually was still packing in there. I just couldn't breathe at all before.
Right, yeah. I've heard that before too. It's like, it may seem okay now, but it's going to get a lot better than it is, right after the surgery. So, but that's good.
Yeah, the pack is definitely the most challenging part, I believe, but it's just one night.
Yeah, I just put packing in overnight, and some people don't put packing in. I think there's just I think it's better if you do. I think it kind of keeps things in place, and there's reasons for it. So, I'm maybe a little old school in that regard, but I do think it works well. So, and it's just overnight. We see people back the next day, check everything, take the packing out, and all. So, and then the tape and the cast, like you said, that's the waiting game is that week to get that off and all. So.
Yeah, initially when that cast comes off, what you see is what you think you're going to have, but that swelling does go down, and it takes up to a year and even longer depending on the thickness of the skin. But I know when my cast came off, and I know when your cast came off too, we were both pretty happy.
Oh my gosh, I was so happy. I couldn't believe it. And then he told me it would be even, more defined and more small even as time went on, and I was just very happy.
Yeah.
And I'm still very happy to this day with it.
So now when people take photos, I don't know how you feel about this, but I used to always have to turn a certain way, and I never wanted the profile done. But now, game on. Take any angle you want.
I totally agree with that. I would avoid at all costs the side profile angle, but now I embrace it.
Yeah, we have had a lot of patients that have come on the show with us for that same exact reason, and they were ready for like their wedding photos. So
Yeah.
it does
wow.
bring a lot of satisfaction to help people with their breathing.
Absolutely,
and,
yeah. I
because-
mean, yeah, it is. I mean, it's a challenge, but it is also very rewarding, and we have done that. So, yeah, it's always a lot of fun. It doesn't get old. I mean, it really doesn't get old to do noses like this and have it turn out to have just a really great looking nose that works so much better and all. So.
All right, so we can tie now. We were saying you're the first place winner of the most beautiful nose, but no, I was second. But that's okay. We'll tie. So
I'm
right.
honored to have a tie with your nose.
but I mean, different noses, different faces, apples and oranges, right?
Absolutely.
Yeah, beauty's in the eye.
That's right.
So, have other people noticed besides your close friends, family?
Absolutely. Like I mentioned, people I'm around in class with,
That's
Yeah,
all
that's
right.
right. Yeah.
as well as classmates, and like I mentioned, sorority sisters. I've had a lot of different people comment on my appearance and my nose, especially my friends in high school that saw me before and after my nose.
Yeah. So if you are thinking about having a rhinoplasty, give us a call. The number is 850-484-FACE. That's 484-3223. Ask for me, Andrea, and I will set up a consultation with Dr. Derek Jones, and we will go from there. We're about to wrap it up for the night, and we're so thankful you have watched. Have a great evening. Good night.